and in the UK?
I think it's important to remember that the World Health Organization declared a public health emergency yesterday. Now, that was not because of individual cases coming into or being found in countries like the UK, which have very strong health systems and very strong public health systems. But if we had a situation where the outbreak in China, which is now a very substantial one, was not got under control by the Chinese authorities and spread more widely in the world, then we would consider there would be a risk to the UK of a significant outbreak here. And on that basis, we were planning, and that was the reason why I and the other chief medical officers raised the risk level yesterday from low to moderate in conjunction with the WHO statement. This is not planning because we're worried about individual cases. It is because we're worried that if the Chinese authorities, who are making huge efforts, cannot get on top of this in the next few weeks, we may get to a situation where this begins to spread around the world in a quite major way.
But for the UK and the patients, for individuals here?
For individuals at the moment, I do not think that this increases the risk to individual citizens of the UK. What we were previously saying was that anybody who'd come from Wuhan or the immediate surrounding area, which remains the epicenter of this outbreak, should isolate even if they have no symptoms for 14 days. What we're adding in now, because the rate of transmission in China has gone up, though not to that level that there is in Wuhan for most of the country, that we're saying people who come from wider mainland China, if they get any symptoms of any sort, however trivial, then they should self-isolate and then they should phone 111. If people have no symptoms, that's not what we're going on to, because we don't think the risk is appropriate and we don't think that is proportionate. But for anybody who's got symptoms, we wish them to self-isolate and phone 111.
And finally,
so this is a very standard part of public health practice, and Public Health England are incredibly experienced at doing this. And this is about working backwards through all the people someone might have been in close contact with. And I would like to stress that this is people have been in close contact with, not just passing in the street or something of that sort. So those are the people who we just want to make sure that if they had symptoms, we know about it early and that we're aware of the risk.
how far back their condition?
Well, the first thing, obviously, to say is that we intend them to be housed in a way which is pleasant, and it is in no sense a feeling of punitive situation. That's absolutely not the intention. What we wish to do is to make sure that they're in one place near very good infectious disease and other medical services in the event they need it. But what we hope is that all these people will have 14 days isolated from the general public, but with not in the sense of solitary confinement, and then they will be able to be released without any symptoms at all. If they develop symptoms, at that point, the NHS, which, as I say, is very practiced in this, will be able to deal with those and use whatever methods are needed to treat them in a way that's safe for them and safe for staff and the public. What we're trying to do is make sure that anyone who might come into contact with someone with symptoms is in a position where they are protected, and that's true for any infectious disease. So to be clear, what we're trying to do is put the level of protection in an appropriate way so that people who might have symptoms and might be theoretically able to transmit are in a position where they are protected as well.